We all want safe communities, and we all want healthy communities. This administration has made important strides. We have capped costs for life-saving medications. We've protected safeguards for those with pre-existing conditions. We've invested in affordable care for thousands of lower-income families. We have eliminated copays for behavioral health services, and we've begun the great task of rebuilding a mental health care infrastructure that was decimated. But still, too many people, especially people in the rural areas of our state, don't have timely access to the health care they need or access at all. Every community deserves high-quality care. I propose a new rural healthcare delivery fund that will provide bridge financing to communities that have been waiting for assistance to kickstart construction without massive upfront costs. State government can help fill these gaps. With interventions like these, communities like those in Valencia County are moving towards securing a brand new hospital after years of delays. And with investments like those I have proposed in my executive budget, we will put tens of millions of dollars into new behavioral health services, expanding access to treatment for substance abuse, suicide interventions, and more. New Mexicans call me about this issue more than almost any other, and we will answer that call. We can and must ensure that kind of service delivery is available throughout the entire state. We have the resources to do so. That means endowing our medical school with $10 million, ensuring that we keep our best and brightest here to provide care for New Mexicans after they graduate. That also means endowing our nursing school with the power of the state, ensuring more highly skilled professionals enter this all-important field. And it means, once and for all, delivering the healthcare families in the rural parts of our state still desperately need. I propose a dramatic expansion of the state program that directly supports caregivers. What that means is we are going to pay families who are doing the work of taking care of their elderly loved ones, regardless of Medicaid eligibility. Let's call it New Mexicare, and let's make it a model program for the rest of the country. This is an investment in people that goes well beyond politics or any one politician. This is the kind of investment that can be and should be a lasting service, one that reflects our shared values as a state. In this state, we provide for and care for our parents, our grandparents, our disabled loved ones. This state government under my leadership will help provide for that care unequivocally. Caregiving is a full-time job. I know it firsthand. And we respect working people in New Mexico. So let's invest in the dignity of our elders and of their families by helping caregivers and those they care for stay in their homes with the financial support they need. On the same note, it is time that we build a new veterans home, a state-of-the-art independent and assisted living facility and program for those who sacrificed to protect our freedoms. The original building on the campus in TRC was built in 1936. I think it's time for an upgrade. So I am calling for $60 million, which we will leverage with an additional $60 million from the federal government to build the kind of modern facility our veterans and their families deserve. We're going to get it done. The state of our state is ready to move forward, ready to rise. We have all the tools we need. My vision is this: communities all across our state where families aren't worried about the next bill or their kids' future or a job market or a healthcare system that doesn't quite seem to work for them. My vision is a New Mexico where the founding ideals of this great country, equal opportunity and justice for all, are made real and meaningful, where the pursuit of happiness is more than a phrase from a dusty piece of paper, something tangible, something everyone can actually feel. We can do it all. We have the finances. We're going to fund an unprecedented suite of new affordable housing programs at the state level. We're going to expand protections for voters because we believe in democracy and everyone's right to vote. I subscribe to an optimism that says big things are within our reach and blue skies are ahead. Although in all seriousness, I would take some snow right about now.
COVID-19 has exacerbated every issue facing our healthcare system, and there's no doubt, including access to care. The governor has been pushing for a new hospital in Valencia County for some time now. And Crystal, let's start with you. How important is getting a new facility in that area? And then I'm going to follow up with you, Adrian, about this is an area where she's definitely trying to connect with rural New Mexico and whether or not that's hitting. But how important is that, do you think, Crystal, in terms of a symbol, if nothing else?
Absolutely important, especially since Valencia County is a very fast growing area, especially with some of the infrastructure that's going in. You have to grow with the communities that are represented. And the way that I think about it is it's time, right? If UNM has the major health school and has a campus up in Valencia County, by all means, having a hospital there or medical resources, I think is very important and very vital. I did want to take a moment, though, to kind of talk about some of the other parts that she mentioned in the clip about caring for aging elders, aging families, those that live in the home. One of the things I thought was really fascinating is that, to me, that's major generational healthcare. That's major. And what I mean by generational healthcare is the fact that she's thinking about how New Mexico is not just a one generation household anymore, not just two with your kids, it's three, it's grandkids, it's grandparents that are living with the homes. And that's very common in communities of people of color, right? Hispanic families, Asian families, Black families, et cetera. And so the fact that we are actually getting financial resources or thinking about financial resources in the future, right now, it might not make much sense, but it's going to make sense in about 10 to 15 years from now, when parents like mine are going to be in their late 50s, then they're going to be in their late 60s or their late 70s, whatever that might be. So I think that that's actually a really forward-thinking idea. Of course, a person that has been a caretaker herself, to better understand the needs of the aging community or the senior elder care industry.
Yeah.
So.
Adrian, again, what Crystal just talked about, this hospital, she talked about more resources to help other rural communities build up their healthcare infrastructures, sort of bridge funding to get things going. Are those things that connect in rural New Mexico, where often that access, you have to drive a long ways just to get to a doctor, there are limited amounts of doctors? Does that hit home?
Yeah, I think so. We have pretty limited medical resources, in Carlsbad and places like it. We usually have to drive a town over to, up to Artesia maybe for like the full hospital and for surgeries, things like that. A lot of people end up driving to El Paso, frankly, or to Lubbock to go to the hospitals. So yeah, I mean, it's pretty limited in this part of the state, and anything they can do to increase access, I think, would be helpful. It's been especially strained. I mean, our ICU beds are full. People are, I know, being turned away. Even people with COVID are being turned away, frankly, going to seek medical care. So
yeah,
it is very much lacking in this part of the state and rural areas. And I think that, that was definitely something the governor was trying to appeal to the rural communities. It'd be nice to send a hospital down to Carlsbad too, just like in Belen. I mean, that'd be great.
Right.
Yeah, and to add to that too, it puts the pressure off of the Albuquerque systems. Like Mayor Keller had said it once, that most of the in-state travel that happens, and you look at nonprofits like the Ronald McDonald House, that a majority of the people that use these facilities, or if they come into town, it's because they need access to medical care. So it does put off the pressure off of a big town like ours.
The pressure that is always there too, though, is healthcare providers. She talked about some money for the medical school. But do you think that is going to be enough to meet all these lofty goals she has for us, Julianne? Or is that something we really need to focus on even more to make sure that we're training and graduating the doctors of tomorrow to help fill those spots?
I mean, I think those incentives for the UNM medical program and for the nursing school are critical as you're thinking about the future. But I think that these types of programs have been tried in the medical education, industry. They have been, we've tried to incentivize folks to stay in communities that are identified as underserved, to go to the rural places to practice. And it's not just a problem in the medical school, it's a similar problem in the law school, that all these incentive programs can't convince people to like relocate to Roswell or, pick a city that's medically underserved. And I think that there's got to be some more creative thinking to really create the shift that is necessary to close these kind of gaps. And I don't know that what's been introduced is really going to cover all of that.
It is a lot, and things we've been dealing with forever, and we haven't even really talked about behavioral health, which we know is still something we're trying to rebuild in the statewide. But we've only got a few minutes left and wanted to hit on what else was just glanced upon or not there at all. And the voting measures, which we know is a priority for her and Secretary of State Maggie Toulouse-Oliver, but also environmental. We didn't really hear much about that. I'm curious about that, Adrienne. Again, we talked about the protests there. In fact, the only real mention of water planning was her cracking a bit of a joke about how she would love to have some rain or snow. Why do you think we're not hearing about that when we know our state engineer left at the end of last year, in part because of a lack of funding? She and her budget proposal not necessarily aligned with the LFC about an increase in funding for the state engineer's office. Why is this not in here? And did she have an opportunity to elevate that in the public's mind?
Well, I sort of behind the scenes, they're advocating for, increased funding to Energy Minerals and Natural Resources departments, adding compliance officers to oversee oil and gas. They're advocating for more funding for NMED, for watershed improvements, things like that. There's a number of bills that are pretty environmental in nature that would increase regulation. So I think her agenda is clear when it comes to the environment, but in the speech itself, like we've been saying, she was trying to kind of toe the line, stay in the middle. These sorts of topics are pretty controversial for red parts of the state, especially an energy producing region like ours, that people are afraid that transitioning away from fossil fuels, could transition them out of jobs and out of economic prosperity and funding for our local rural, energy communities.
Yeah.
So, I think that was why we didn't hear about it. But I think it's clear that they're still pushing this, what I call a green agenda.
Yeah. Only about 30 seconds left, Julianne, but same thing for you. Like, does the governor have a responsibility to elevate, if she's got all these bills, if it is a priority, does she have an obligation to sort of elevate that in her speech so the state knows this is an issue? We're in court with the federal government in Texas and the Supreme Court about water. We are in deficits in the Middle Rio Grande. Does she miss an opportunity to really elevate that for the state as a whole as she sets priorities?
I think it's clear she missed that opportunity. The question of whether she's obligated to mention that, I think the answer is no. This is a political opportunity for the governor. This speech, kind of sacred space being held for the speech at the beginning of the session is, it's kind of her time to shine and pick her issues. And I do think that, the calculation of what she chose to talk about, no mention of the Rio Grande, no mention of the drought, no mention of the, ongoing problem with Texas. I think, that's not totally unexpected.
All right, great. Well, we got to move on from that, but we'll get right back to you guys in just a minute. But we end with the governor's larger philosophical message, a call for unity and a change in mindset.